My name's Dr. Luke Lenci. I'm a cataract and refractive eye surgeon here at Missouri Eye Institute. I decided to come back to the Ozarks to practice mostly because I love the area. I grew up in Lake of the Ozarks, did my medical school training up at Mizzou in Columbia, and did my eye surgery training at one of the best programs in the country at the University of Iowa, and really wanted to get back to the Ozarks. I love the trees, I love the lakes, I love the streams that we have, and of course the patients that we get to take care of are salt of the earth, down to earth people, and I enjoy it very much. Missouri Eye Institute's a very special place. I love working here. I love being a part of this team. Number one, we have amazing doctors. I think it starts with having doctors not only who are very skilled at what they do. I mean, we do thousands and thousands of these procedures every year. That's the most important thing. But then having a collegial environment to work with other doctors who really care about our patients, who really care about having the best technology so we can deliver the best outcomes for patients, that's hugely rewarding. Secondly, I think working with our staff. I mean, when patients come in, they feel like they're a part of our family, and that's an important way to get the best care you have, because not only is it just doing the procedure, but the whole feeling that you get and the whole process, it can be nerve-wracking, and I want our patients to feel very well comforted, and as a part of our family, we know that we do a good job of that. I had a strong interest in basically learning how to do a type of surgery called extracapsular cataract extraction. In fact, that's the old way we used to do cataract surgery. Now we do it through a very microscopic, tiny incision, but in third world countries we do it the old-fashioned way a lot of times because there's not equipment available. And so I really had a strong desire to learn this technique and help patients in that way. One of my most rewarding experiences as an eye surgeon was when I did go do a mission trip to Honduras, and I interacted with a patient who was blind in both eyes. She was a young patient and unfortunately developed gestational diabetes. And so by the time she actually delivered her baby, she was blind from cataracts in both eyes. And so as the surgeon for her that day, I got to remove those cataracts, and she was able to see her baby for the first time. And so to me, a story like that is obviously pretty dramatic, but that's just a small snippet of what I get to do day in and day out. And that's a great privilege. And for me, that's a story I'm never going to forget. And I can't wait to do that for many other patients. The most rewarding part of my job is honestly restoring sight for people. I mean, it's such a great thing to be able to improve the quality of life of patients. There's so many ways that our sight affects what we do in our enjoyment of life. And so there's so many great surgeries we get to do. In fact, cataract is probably the most common thing we do, but boy, is it life-changing for people. In fact, I had a patient recently write me a letter of thanks, and she said, "I haven't been this happy since my wedding day." So those are the kind of things that we get, and it's a wonderful privilege to be able to help patients see better.